And Dr. Jeff Pothof with UW Health is with us now. And Dr. Pothof, we appreciate you being with us and always offering your expertise. One thing that is on a lot of people's mind is that variant. We know it's a lot more contagious. Now, this make it much more concerning for you.
Yeah, the worry with the new variant is it could increase hospitalizations, not because it's a more severe form of the virus, but because it might make more people sick. Um, One of the things that we are looking at is, how widespread will this variant become? We're worried that it could be in the state already. But the good news for the public is that we know how to stop this. If you wear a mask, if you socially distance, that's still effective against this variant. But if you cheat on those things, this variant is more likely to infect you.
Yeah, that's very scary. You just got to make sure you still wear the masks and be vigilant. Dr. Pothof, yesterday, Governor Evers said that probably vaccines won't be available to the general public until June. Now, a lot of people might be thinking, okay, I'm going to plan on my activities, my family reunion, my trips, my vacations around after that time or around that time. Is that a good idea or is that not good? Give us your take on
Yeah,
that.
I think we will really have to play this by ear. Governor Evers might be right that vaccines won't be available till June. I know here at UW Health, we'll try to do everything we can to prove them wrong and get them out there before that. But this is a complex process. It's massive. There's lots to take into account. Certainly what we don't want people to do is to make plans that then have them maybe doing things that put them and their family at risk if they have not yet got the vaccine when those plans will happen. So June seems pretty safe. If it's before that, make sure you're playing it by ear. If you're not yet vaccinated, these plans of travel, close gatherings, things like that, really can't do them.
Yeah, definitely uncharted territory. Dr. Pothof, can you tell me how many people do we need to get vaccinated to reach that herd immunity or to make sure that COVID-19 is not quite the crisis it is right now?
The number that we're really aiming for is 70 to 80% of the population. Once we get to that number, then the likelihood of the disease able to spread amongst people becomes much less. But early on, even with healthcare workers vaccinated, we're not there yet. We've got a long ways to go.
Yeah, that's it's a long ways to go, and unfortunately, we just have to stay vigilant, like you say, wear those masks. Dr. Pothof, thank you again for being with us from UW Health.